Good morning everyone mga kababayan ko. Maraming salamat for tuning in today. Sa mga bago kong subscribers in this journey na ginagampanan ko ngayon, maraming salamat. As your breastfeeding and lactation consultant, I am here to provide you the best evidence-based information na kalimitan hindi nyo nakukuha sa ating bansa dahil alam kong we're so behind and we have lack of resources when it comes to lactation consultation. I-clear ko lang, okay, for some of you na nag-message sa akin, there was a mom na nagtatanong sa akin na she was trying to see a breastfeeding consultant na tina-charge siya ng medyo mataas na fee. So, i-clear ko lang sa inyong mga nanay na nangangailangan ng breastfeeding consultation. Isa lang po ang term na lactation consultant. Okay? A lactation consultant, isa po yung profesyon na aabot ng 2 to 3 years bago mo makuha ang lisensya na yan. Ang tinatawag po nilang breastfeeding consultant ay wala po yung term na yan. Okay? There's a breastfeeding educator. We can take that, breastfeeding educator, pero hindi po dapat gagamitin ang breastfeeding consultant pag hindi ka lactation consultant or IBCLC examiner. Kaya kalimitan nako-confuse ang mga nanay to see a breastfeeding consultant. Kaya kayong mga healthcare professional, if you are not an IBCLC license, you cannot call yourself as a consultant, lactation consultant. Hindi po ganun. That is against the law. Kaya mag-ingat kayo kung ano yung mga title na ginagamit ninyo para nyo mahikayat itong mga nanay to come and see you. Dahil nag-iisa lang po ang lactation consultant na term. Hindi po yan ginagamit kung anong basta-basta na wala kang pinag-aralan ng 2 to 3 years. Natatapusin mo lahat yung mga kurso bago ka maging lactation consultant. So as a lactation consultant like me, it's kind of unfair doon sa mga tao na ginagamit lang yung pangalan naming less license naming ngalan para lang tatawagin silang consultant. No, you can be a breastfeeding educator. Madali lang po ang breastfeeding educator. Kahit isang linggo, pwede ka ng breastfeeding educator. Pero iba po kaming mga lactation consultant. We specialized breastfeeding and it took us years. Hindi lang weeks as compared to mga breastfeeding educator, okay? Breastfeeding educators, yes, may konti silang kaalaman about breastfeeding, pero hindi po kasing lawak ng kaalaman as compared to us lactation consultants, okay? Now, i-clear ko kasi the reason why I'm saying this, ito ay question and answer again. After New Year, may nag-message sa akin, kudos, shout out to mga nanays in Palawan. There was one nanay in Palawan na nag-message sa akin through my FB account. At ito ang tanong, ibabasahin ko lang, okay? Hello, Ma'am Alona. I have a concern, Ma'am. Napanood ko kayo sa YouTube niyo po. Namumuo po bukol, daddy ko dahil sa gatas. Anong remedy po pwede kong gawin? Okay. So, nagkaroon siya ng bukol. Okay? Sa kanyang breast. That's after, I think that was after New Year Day. So, ang bukol is kind of either pagbukol na matagal na, maybe it's a very, very concerning na kailangan nyo talaga ipa-chat. Pero pag bukol na pagising mo lang sa umaga, nagkaroon ka ng bukol and then it goes away, ang tinatawag po noon ay plugged ducts. And I had a video on this before about plugged ducts, pero ulitin ko uli for the sake dito sa nanay na ito na nagtatanong about anong remedy ng plugged ducts. So, this nanay na nag-message sa akin from Palawan is a second-timer mom. Medyo matanda na yung panganay niya and this is her second baby na bigla na lang I think it happened to her twice now na nagkakaroon siya ng bukol. The singlaki ng bukol, I was asking her, baby was more than a year old, sinlaki ng bola ng roll-on, ang laki ng so it's just like this, is like this. Ang laki ng bola ng roll-on. So, ang sabi ng doktor sa kanya, at ito ang ulit-ulit kong sinasabi before, na hindi lahat po, hindi ko minimenos, hindi lahat ng doctors are lactation consultant. That they have really deep knowledge about breastfeeding problems because we studied that for years as a lactation consultant. Ang sinabi ng doktor niya ay lagyan ng warm compress. Ito na naman yung mali na lagi kong sinasabi, na depende po gaano ka-severe yung plug duct. Ngayon, kung doktor ka at sasabihin ng nanay, Dok, may bukol ako sa breast ko, put a warm compress, mawawala na yan. Without assessing how big it is. Without assessing the severity of pain. Kasi ganito yon. Kayong mga nanonood ngayon sa akin at kung nagbe-breastfeed kayo, it can happen kahit baby pa yung anak nyo o lumalaki na yung mga babies nyo. Pag nagbe-breastfeed kayo, may time talaga nagkakabuhol kayo. Meaning, either you miss 2 hours of breastfeeding or natulog ka on that side na for a very long time na nakat yung circulation or you went shopping na nalagay mo yung strap ng bag mo dito sa side na to na it cuts the circulation or it's just happen na nasubrahan yung milk mo, hindi na empty ni baby, nagkakaroon ka tuloy ng tagda. Ang kamalian ng ganitong ang sinasabi ng mga ibang healthcare provider, hindi ina-assess kung gaano kalaki at gaano kasakit. If it's a tiny little marble, katulad ng butel ng mais, pwede yung matunaw sa warm compress. Pwede yung matunaw. At hindi pa masyadong maga yung ducts mo because it's a tiny butel ng mais. Could you imagine yung bukol nitong nanay na nag-message sa akin na to is up to a roll-on, ball ng roll-on. So, ganito yan siya. Ganito. Biruin mo, ang ducts natin is like a straw. Yung straw na iniinom natin sa soft drink, parang maliit pa dyan yung ducts natin. Could you imagine na bara yun siya? Na kasing laki ng ball ng roll-on? So, meaning, very stretched na yun, inflamed na yun, kaya ang sakit. And then, ang sabi ng doktor, put a warm compress on it. Wrong! Mali po! Kailangan tingnan natin gaano ba kalaki yung mga bukol at gaano ba kasakit because it's really painful. If it's really inflamed, lalagyan mo ng warm compress, lalo tuloy mag-inflame. Ngayon, hindi masyadong, ewan ko ba, kaya yun talaga lagi kong kino-correct when I do workshop in the Philippines with the nurses, with the DOH nurses. Kasi, may tama at may mali na binibigay na information and I want to straighten it. I want to make sure na isa lang yung paraan na gagamitin natin in a right way. Ang warm compress, ito yung uulitin ko na naman dahil paulit-ulit itong tanong na to ng mga nanay. Ang warm compress po ay ginagamit ko sa aking clinic, sa aking mga pasyente, kung gusto kong padamihan ng daloy to increase the flow of the milk without any severe pain, okay? Without any big bukol. Warm compress po ang ginagamit ko. To increase the flow, to soften the breast. Pero po, if your breast is may bukol ka na nasing laki ng ball ng roll-on, o namamaga na yung sign na to, and then you're gonna put warm compress, mali po yun, mali po talaga. Kailangan cold compress. Okay. Now, how long you gonna do the cold compress? Now, this is what I do in my patients sa aking breastfeeding clinic, okay? Yung cold compress, you can do it every 2 to 3 hours. Ilagay mo yan 10 to 15 minutes. Ilagay mo yan sa area na nagbukol at masakit, okay? 10 to 15 minutes kung kaya mo. You can put kahit ice pack or frozen vegetable na nasa freezer mo, wrap it with a towel, na face towel ba, don't put it right away straight in your skin, okay? You have to wrap it ng towel at ilagay mo dyan. 10 to 15 minutes. Do it every 2 to 3 hours, okay? If it's too painful to breastfeed on that side, use the other side. Continue to put it. Pag napi-feel mo during, let's say you start in the afternoon, pag napi-feel mo in the afternoon na medyo lumiit-liit na yung bukol, at minamasahe mo yun, lumiliit lang yung bukol mo. If the bukol is already so small, na mga butil na ng mais, then change it to the warm compress. Ibig sabihin nun, natunaw na yung plug na malaki doon sa ducts mo, and the swelling goes down as well. Okay? Pag less na yung pain. Pag severe pain, ibig sabihin nun, talagang inflame na yun. Pag wala nang masyadong masakit, ibig sabihin, the swelling goes down already. So, ganun po. So, again, I'm telling this to any healthcare providers watching me right now as your lactation consultant. You need to have good assessment dahil minsan po mali ang turo na binibigay natin sa mga nanay and they become confused. So again, what is the side effect kung lalagyan mo ng warm compress? The swelling get worse. The flow of milk or fluid, hindi lang milk, the fluid that goes into the ducts cause more swelling and pain because again, magang-maga na yun eh. And then you're trying to push this fluid out na magang-maga yung duct. You need to let the swelling goes down first to lessen the pain. Kasi if the pain increases and the swelling increases, wala pong magandang flow ng milk. So, dapat sana naintindihan ng lahat at nagpapasalamat ako for the nanay from Palawan who messaged me and asked me question about the remedy on how to relieve plug ducts. And if you haven't watched my video about plug ducts, repeated plug ducts, because it can happen again, watch that video. Hindi ako doktor na pwedeng magsabi sa inyo na inom kayo ng gamot to this. Ask your doctor, and I know na for any inflammation sa ating katawan, you can take ibuprofen, but make sure you ask your doctor about medication. Dahil again, kung may mga consultant daw kayo, breastfeeding consultant, nagsasabi sa inyo na take this, at hindi sila doktor, wala po silang, they have no right to tell you what medication to take. Dahil hindi po kami doktor. We are lactation consultant, okay? So, you need to know kung totoo ba talaga ang pinapuntahan yung lactation consultant. They have to have a certificate on their wall as IBCLC, meaning they're International Board Certified Lactation Consultant, okay? Huwag po kayong magpauto. Kailangan pong alam nyo kung sino yung pinuntahan nyo at alam nyo na tama yung tinuturo sa inyo. So that's why I'm doing this. Dahil alam kong bibihira lang kayo makakita ng lactation consultant sa ating bansa. Because number one, it costs so much money for these nurses or healthcare providers to pursue a career as lactation consultant at kulang na kulang tayo sa resources sa ating bansa. Kaya ginawa ko itong platform na ito sa YouTube channel dahil alam kong maraming mga nanay nangangailangan ng tulong when it comes to breastfeeding problems. So, again, do your questions, do your comments. Kung hindi kayo komportableng mag-message sa akin dito sa Facebook, sa YouTube, you can message me in my Facebook account, Alona Forche, and I will answer your questions. I will help you with your breastfeeding problems. And thanks again for tuning in. Please, don't forget to subscribe. Every 2 to 3 days, may mga videos ako about breastfeeding. And tell me what you want to know about breastfeeding. Again, this is your lactation consultant na nagsasabi sa inyo na I'm willing to help you kahit malayo ako, to share my knowledge and skills and to help you and your babies to stay healthy and breastfeed healthy. Or kahit formula feeding kayo, I salute you for the best job that you did for your babies. Okay? Thanks for watching. More videos to come. Bye for now.